Welcome to this deep dive. Today we're looking at peripheral arterial disease,
That's right.
specifically how it's managed conservatively, meaning without jumping straight to procedures.
Exactly. We want to focus on managing it, when there aren't symptoms yet, or when people have that leg pain with activity claudication.
Okay. And our aim here, what are we trying to get across in this discussion?
Well, the goal is really to clarify how these non-interventional strategies work. Things like optimal medical therapy, definitely quitting smoking,
Mm-hmm.
and the role of exercise.
Right. Crucial stuff.
Yeah, whether you've got symptoms or not. We pulled this from, medical guidelines, basic vascular biology info, surgical texts, clinical approaches, a real mix.
Good stuff. Okay, so let's kick things off. What exactly is peripheral arterial disease? Lay the groundwork for us.
Sure. So basically, it boils down to reduced blood flow to your limbs, usually the legs.
And what causes that reduction?
It's typically atherosclerosis,
Yeah.
where you get that buildup of fatty deposits, plaque inside the arteries.
Ah, so it narrows the pipes, basically.
Precisely, like a pipe getting clogged over time, hindering that smooth blood flow.
Got it. And you mentioned it's not always obvious.
Right, it exists on a spectrum. Some people have the underlying condition, the narrowed arteries, but they don't actually feel anything.
Oh.
No symptoms at all.
Asymptomatic, they call it.
Exactly. Then others develop claudication. That's the pain or discomfort, often in the calf or thigh, maybe the buttock.
Only when active, though.
Typically, yes. It comes on predictably when you walk or exercise, and then eases off when you stop and rest. It's a sign the muscles aren't getting enough oxygen during that exertion.
Okay, that makes sense. But here's something maybe people don't realize. Even if you don't have the pain, just having the disease itself, that carries risks, doesn't it?
Oh, absolutely. That's a key point. Even without symptoms, the presence of peripheral arterial disease means you have a significantly higher risk of other cardiovascular problems.
Like heart attack or stroke.
Exactly those. So even if your legs feel fine, the underlying condition warrants attention because of that broader cardiovascular risk.
Which leads us naturally into managing it, right? The conservative approach.
Precisely. And the cornerstone of that is what's called optimal medical therapy.
Okay. And the goal is there.
Two main things, really. First, reduce the risk of those big cardiovascular events, a heart attack, stroke. And second, actually improve your functional capacity, your ability to, do daily activities.
Makes sense. So what does this optimal medical therapy actually involve? What kinds of treatments?
Well, a really key part is antiplatelet therapy, medications that help stop blood platelets from clumping together and forming clots.
And that helps how?
It's been shown to improve outcomes, both heart-related and leg artery-related outcomes. And that benefit applies whether you have symptoms or not, and even if you end up needing a procedure later on.
Okay, so antiplatelets are foundational. What else?
Managing high blood pressure is crucial. Certain medications, like ACE inhibitors,
Angiotensin-converting enzyme inhibitors.
right, those have been shown to reduce clinical events in people with peripheral arterial disease. And interestingly, they also seem to have properties that can help slow down that plaque buildup process itself.
Anti-atherogenic property.
That's the term, yeah. So double benefit there, potentially.
Good to know. And what about cholesterol? Statins usually come up there.
Absolutely. Statins are vital. We know they lower cholesterol. But for peripheral arterial disease, they also seem to reduce the risk of needing limb procedures later on, like bypass or angioplasty, and even lower the risk of amputation.
Wow, that's significant.
It is. And they can also help reduce the symptoms, like the claudication pain itself.
So it sounds like these medications are incredibly important. Is there good uptake? Are people getting these treatments?
That's actually a bit of a concern. Sources suggest that patients with peripheral arterial disease are often less likely to receive these guideline-recommended therapies compared to, say, patients with coronary artery disease.
Why do you think that is?
It's hard to say for sure. Maybe less awareness, maybe symptoms aren't seen as cardiac, but it highlights a gap. We need to make sure people with PAD get this essential medical therapy.
Because the statins also manage the unhealthy fats, the dyslipidemia.
Exactly. And they have those other sort of bonus effects, the pleiotropic effects, beyond just cholesterol lowering, which can be really helpful in this disease.
Okay, so medical therapy is huge. What's next on the list for conservative management?
Something absolutely critical: smoking cessation.
Ah, yes. Always comes up with vascular health.
And for good reason. Smoking is a massive risk factor, not just for getting peripheral arterial disease, but for it getting worse over time and for having those major cardiovascular events we talked about.
So stopping smoking isn't just helpful, it's Essential.
Unequivocally essential.
Mm.
If you have peripheral arterial disease and you smoke, quitting is probably the single most impactful thing you can do for your health. It's a fundamental pillar of managing this condition.
No ambiguity there.
Not at all.
Okay, let's shift gears to something patients can actively do day to day. Exercise.
Yes, exercise therapy. This is another key component, especially for folks experiencing claudication.
How does it help with that leg pain?
Well, regular structured exercise, often walking, can actually improve the distance you're able to walk before the pain starts.
Really? Even with the narrowed arteries?
Yes, it also tends to reduce how severe the symptoms feel. It's thought to help your muscles become more efficient at using oxygen, and maybe even encourage the growth of tiny new blood vessels, sort of natural bypasses.
That's fascinating. So pushing through a bit of discomfort can lead to real gains.
Within reason, and ideally as part of a structured program. But yes, that's the principle.
What about people who have the disease but no symptoms? Does exercise still matter for them?
That's a good question. Some evidence suggests that even asymptomatic individuals might experience a gradual decline in their walking ability or function over time without realizing it.
Kind of a silent decline.
Sort of. So exercise might play a preventative role there too, helping maintain mobility and function even before symptoms appear.
It also counters that tendency to just stop moving because it hurts, right?
Exactly. With claudication, it's natural to want to avoid the pain, so people often become less active, which can actually make things worse in the long run. Exercise therapy aims to break that cycle.
Okay, so let's pull this together. For someone diagnosed with peripheral arterial disease but no symptoms yet, what's the conservative plan?
It really comes back to those foundational things. Optimal medical therapy is key. So likely an antiplatelet, definitely a statin, and an ACE inhibitor if their blood pressure warrants it.
Primarily to reduce that future heart attack and stroke risk.
Precisely. And then aggressive risk factor management. Number one, if they smoke, they absolutely must stop.
And managing other things, too.
Yes. Controlling high blood pressure, keeping cholesterol levels healthy, managing diabetes if they have it, all those are crucial for slowing down the disease progression.
Got it. Now, what about for someone who does have claudication, that activity-related leg pain?
The foundation is the same. Optimal medical therapy, antiplatelet statin, blood pressure control. And again, smoking cessation is non-negotiable if they smoke.
But you add something else in for claudication.
Yes, that's where the structured exercise program becomes really central. Regular walking, usually supervised initially, to push that pain threshold gradually and improve walking distance.
Retraining the body, in a way.
That's a good way to put it. Helping the body adapt and function better despite the limited blood flow.
Are there any specific medications just for the claudication symptoms?
There are some. Cilostanzol is one medication that has shown some benefit in improving walking distance for people with claudication.
Is it widely used?
It can be considered. It's something to discuss with your doctor, weigh the potential benefits against any side effects or interactions with other medications. It's not usually a first-line therapy before exercise, but it's an option.
Oh, okay. Now, this conservative approach sounds really comprehensive. Does it always work, or are there times when it's just not enough?
That's an important reality check. Conservative management is absolutely the first-line approach for most people with asymptomatic disease or mild to moderate claudication. But it doesn't always prevent progression, and sometimes symptoms can become severe despite best efforts with medication, quitting smoking, and exercise.
So if the leg pain becomes really debilitating, affecting daily life significantly?
Exactly. If someone has severe lifestyle-limiting claudication that doesn't improve, or if they develop something more serious called critical limb ischemia, which involves pain at rest, or even tissue loss like ulcers,
And you might need more.
then interventions to actually restore blood flow like angioplasty, stents, or bypass surgery might become necessary. But that's a step taken only after conservative measures have been fully tried or if the limb is acutely threatened.
Right. So the focus today has really been on that crucial first stage of management.
Absolutely.
Yeah.
Because for many, many people, this comprehensive conservative approach is incredibly effective.
So let's wrap this up. Key takeaways.
I think the main message is that conservative management is powerful and multifaceted. It involves taking your prescribed medications diligently, the antiplatelets, the statins, blood pressure meds if needed.
Critically important.
Absolutely. Then, stopping smoking if you smoke, that's huge. And finally, engaging in regular exercise, especially a structured program if you have claudication.
And these aren't just about managing leg symptoms, are they?
Not at all. They are fundamentally about reducing your risk of very serious events like heart attack and stroke, and about maintaining or improving your ability to function and live well.
Excellent summary. So maybe a final thought for our listeners to ponder.
Yeah, maybe think about this. Considering all these different parts of conservative management, the meds, the smoking, the exercise, the other risk factors, well, what's one small, consistent change you could realistically start today that would contribute positively to your vascular health?
A great question. Something manageable but consistent.
Exactly. And whatever that is, or whatever questions you have, the most important step is to discuss it all with your healthcare providers. They can help tailor the best plan for your specific situation.